diabetic cats can start getting like tingling pain. We just have to be mindful of all it. And then muscle pain, cramps, over-exercise. How many people have taken their dog to the dog park, overdone it, and then they come home and they're like, oh. Yeah, yeah. We have to start relating to these guys and start thinking about, okay, what do I go through? If I overdo it with exercise, if I've never done anything and then suddenly decide to go run a 5K, am I going to be painful the next day? Absolutely. So we need to start anticipating and trying to relate to these pets in a way that makes sense. I anthropomorphize a lot. And I'm okay with it if you guys too. If you guys do too. Because especially when it comes to pain, empathy is really, really important. And what we know is that we're not good at diagnosing it. So we have to be really good at extrapolating. Alright? I have given you a pain pathway. I do not expect you to memorize this. There will not be a test at the end. But I wanted to kind of explain to you how this is going to relate to our drug therapies. Because when we're talking about multimodal pain management, multimodal means using multiple drugs or multiple approaches because you get a synergistic response. It's greater than the sum of its parts, basically. So if we use multimodal pain management, we're more likely to get a better response and lesser risk for side effects. How many people have heard bad things about side effects from pain meds? Let me share with you what they've heard.
Wasn't experienced.
Okay.
Because nausea, hives, itching, gas, open up, and then problems breathing.
Yeah? Yeah. So that sounds more like along the opiate class, where you're going to
Constipation was another one.
yeah. And then we get to talk about how many people, I think that if you Google Rimadyl dogs, you will come up with, I told you, Google is bad for your mental health. You will come up with horror stories about how terrible this drug is. Not true. All pain medication should be used to the lowest effective dose. If you remember nothing else today, I want you to remember lowest effective dose. The lowest dose necessary to resolve clinical signs of pain. And often we can achieve that by using multiple options. So when we're looking at, and you can't really see it, but there's a little pain stimulus on this is a Vizsla. A little pain stimulus on the Vizsla's foot. Let's say he wrenched a digit. He got his toe caught in the Berber carpet and wrenched the toe. So now he's got inflammation at the joint. Inflammation at the joint then causes fires into the nerves that go up to the spinal cord, travels up the spinal cord, and then received by the brain. We can block that pain or address it at least 3 of those sites. The first is something simple like an anti-inflammatory, a non-steroidal anti-inflammatory. A non-steroidal anti-inflammatory is processed by the liver. We have a lot of different options. They do, however, have to be used with a lot of caution in cats. Cats are very sensitive to them, and there's only one drug on the market that's licensed for use in cats, and it's only licensed for 3 days. So cats are really sensitive. We really run the risk of hurting their kidneys, so we have to be really mindful of that. If you gave your cat Tylenol or aspirin, you could kill them. So don't do that. But we can use non-steroidal anti-inflammatories to treat locally. In the space in between those bones, at the joint space, if we address it with an NSAID, we're going to reduce the inflammation, the cells releasing those chemicals that trigger all the surrounding nerves. Okay, so there's one site to treat it. Well, let's say this dog is really painful. Maybe he fractured his toe. Well, then we can block it at the nerves by using something like gabapentin. Gabapentin, nobody really knows why or how it works. It's in the same class of drug as Lyrica. We keep seeing all these ads for it. Pregabalin is what they use in humans. Gabapentin in dogs we use to treat nerve pain. It also has anti-seizure activity. Again, we don't know why it works. It's pretty safe. We don't have any evidence that it's toxic. I mean, it's a good drug. We just don't know why it works so well. But that blocks those nerve impulses. So once we cross off this, because we just treated with NSAIDs. Well, then if we block it here, that's great. But let's say it's still really severe. We can block it here with opiate pain management. So we can actually address pain at 3 different sites and manage to lower our doses by blocking pain at multiple sites. What are the risks of those? And we have to talk about that, because let's be honest, we never want to hurt. We always want to help, right? First and foremost, do no harm. So, I have the whole list of pharmaceuticals for you. Well, I shouldn't say the whole list, but a pretty good option. So let's talk about the NSAIDs. How many of you have used at least one of these drugs for your pet? Pretty popular, right? They're great for mild or short-term pain, but they do have very well documented side effects. Those side effects being that about 1 to 3% of dogs will have elevated liver values with long-term use. This is where that whole Rimadyl is bad thing comes in. When there are so many doses dispensed, when there's millions of doses dispensed, somebody's going to have a horror story, right? That's where that comes in. It's about 1 to 3% of dogs will have elevated liver values with chronic use. Now, what defines chronic? We're talking regular, week after week, with more than, say, 3 doses per week. So in those dogs that need long-term support, really arthritic dogs, or, dogs that have hip dysplasia, or, it's usually just really arthritic dogs, or dogs with like cancer pain or something like that. If we're going to treat with those long-term, we're going to be monitoring blood work every 6 months. So when your doctor says, I want to check blood work, they're fine. We want to make sure they continue to stay fine. Because if we fail to monitor that blood work, let's say they have an adverse reaction with the drug, maybe they're that 1 or 3% of dogs that reacts to it. We can either switch drugs, find a different class, or find a different entire approach to pain management. So there's never a good reason for us to use a drug if they're having side effects. I have too many options available to me. As I said, there's one label for cats. Onsior is fantastic. It is great for use because it's a tiny little tablet, and shockingly, the cats eat it. Like, I don't know what they said it's yeast flavored, but for whatever reason, the cats eat this stuff. We give it the day of surgery, and then the 2 days post-op, and it's amazing. Comfort level is dramatically increased. But again, it's only labeled for 3 days. So then we get down to the discussion with owners. What if we've got a really chronically painful cat? And that happens. The question is it worth taking monitoring for side effects or having a chronically painful cat? And that becomes a discussion that you have with your veterinarian based on the pet and based on the response of their treatment. So while it may not be labeled, we are allowed to change dosing recommendations at our discretion based on the patient. All right? Does anybody have any questions about NSAIDs before we move on? Because they're so common. Okay? Steroids. Who's used steroids on their pets? Somebody list off some of the side effects for me. You've all been there. No?
Irritable.
Okay. But no, nobody dealt with the peeing and the drinking?
Yeah.
Peeing, the drinking, the eating? Okay. Steroids. They are a wonder drug because they will make anything feel better. We're not talking anabolic steroids like the athletes use. We're talking prednisone. It reduces inflammation, but it has even more documented side effects that are 100% predictable.
They're given a lot to dogs that have allergies, correct? Like severe allergies?
They can be, yeah.
And doesn't it have like liver damage?
It does.
Okay.
Yeah,
I've
so
heard a lot. I've heard a lot about that.
we are trying really hard to move away from it, but there are those cases where nothing else works. And again, it becomes an issue of, okay, is it worth the side effects to give the pet some comfort? If this were you or me, and you had unremitting pain or unremitting allergies, and they said, look, you're going to want to drink a ton, and you're going to have to be in the bathroom every 2 hours, but do you want a cure for do you want your allergies managed, or do you want your pain managed? Most of us would probably say yes, right? Again, it becomes a quality of life discussion. Pain has a huge impact on quality of life. So steroids have a lot of side effects. Whereas with NSAIDs, it's maybe 1 to 3% of pets will have elevated liver values. As soon as I put your pet on steroids, those liver values will go up. The good news is, as soon as we take them off the steroids, they get better. So it's not a permanent thing. This is not something that's going to, like, there is value in it, let's put it that way. But we want to use them judiciously. The other thing is they cannot, under any circumstance, be used in combination with NSAIDs. So if you know your pet's on prednisone for whatever reason, let's say they have allergies, and you have to go to the emergency vet because they injured themselves and they try to put them on NSAIDs. Remember, you cannot use prednisone with any of the NSAIDs. You will almost certainly cause gastric ulcers. When we put those two together, we will burn a hole in their stomach. Let's not do that. But that's where the onus again comes on the pet owner, because it's not uncommon to see pets either from out of town, or as, you know, for whatever reason I may be seeing them for the first time, and they might not have all their drug history. So it's really important that as pet owners you know what meds your pet's on and what things to look for. Again, if they're on steroids, they need to be having their blood work checked every 6 months. Some of these pets with autoimmune arthritis, this is like rheumatoid arthritis in humans, they cannot be managed with NSAIDs. They have to be managed with steroids. They have to be managed with something that has an immunosuppressive effect. It sucks. We don't like it. But again, we have to have that quality of life conversation. So we have to make them comfortable. I've got one little patient that we saw from one of the rescues. He had luxating patellas where both of his kneecaps slipped out of place. He had a torn cruciate on one of the knees. He ended up having to have one amputation of his hind leg, and then the other one's so arthritic, and then he's got autoimmune arthritis. I mean, his joints are a mess. But with judicious use of steroids and another immunosuppressive drug, we've kept him mobile for years, and he's happy as a clam. And we've got him just figured out, so he has just minimal elevation of his blood work values, and we're, 4 years out. This is Poppy, about 4 years out now, and he's comfortable and happy. So there are reasons that we do this, and there's no flow chart. If this, then this. That doesn't exist when it comes to pain management. So then we get to talk about opiates. Woohoo! These are controlled substances, right? They work great. So how do opiates work? They block the pain reception of the brain. When my stepfather had meningitis, he was on morphine, and he said, it's not that you don't hurt, it's that you don't care. And that's probably, right. So what are some of the side effects? Drowsiness, sedation, respiratory depression. So if we're trying to maintain a quality of life, and they're just sleeping day in and day out, they may not be painful, but how's their quality of life, and how's your quality of life? It's not rewarding when we watch our pets just sleep all day long. Okay, maybe we've made them feel better, but that's not the interaction we want to have with our pets. Unless it's, if they're a beagle that sleeps 23 hours a day as it is, then maybe that's normal. But I don't want to give your dog so many drugs that I keep them sedated. They work really well. They are very safe at the right doses. There's also the risk for mishandling. Theft. You can have, nobody ever wants to think of this, but obviously there's always a risk. A lot of these are more human drugs. So we have to be very mindful of that. And so we have to keep very close track of how many we dispense, how often we dispense it, and keep an eye on things. So there have been incidences of what we call diversion, where we're getting phone calls too often for refills. And so if we start questioning you, just know that we're trying to look out for everybody involved, right? But again, they are very, very safe. These are most commonly used for deep pain, really severe pain. If your dog skins its knee, or if your cat jumps off the bookshelf and seems a little stiff, we're not putting them on opiates. This is for severe pain. Because again, the side effects of sedation are not usually worthwhile for something that's going to clear up in 2 or 3 days. And then we get down to nerve pain.